Good evening. I'm Dr. Aparna Mahajan. I'm a consultant of ENT and head and neck surgery. So it is about your oral health and how your oral health affects your respiratory tract and leads to respiratory infections. Your mouth usually contains a lot of soft and hard parts like gums and teeth and etc. So the mix of the soft parts that are vulnerable to bacteria infections, and even your teeth are vulnerable. So if you have a dental caries or you have a dental infection or the hygiene is not very good, then you can have a lot of species in your mouth, which can be pathological and they can be commensals also. Commensals means that they are normally there, that's a normal flora of your mouth, or they can be some organisms which can sometimes turn as pathological. So they can cause infections and they can travel to the lungs, leading to lung infections. Like, for example, actinomycosis is one type of infection which can travel to lung, and it can lead to like dental infections lead to such kind of an infection. And if it goes to the lung, it can cause a infection like a pneumonia like a situation, and then certain bacteria which are responsible for dental conditions can be inhaled into the lungs, and they can, in most cases, the oral microorganisms, they play a role of helping the immunity, buildup of immunity. But when there is, if you are on some antibiotics or there's a pathological organism going into your oral cavity, then or your immunity is weak, then in those cases, these normal organisms can also become upon get an opportunity to give an infection. So that is called as opportunistic pathogens, and they can lead to pneumonia-like situations in the lungs as well. And certain people with neurological conditions like stroke, they are usually not neglected and they are not having a good hygiene, or their oral hygiene is not kept well, then they are also vulnerable to many of the respiratory tract infections. And additionally, there are other factors like smoking, diabetes, intubations, and prolonged stay at the hospital, or also many people who are taking steroid sprays or steroid nebulizers. They are also at risk of fungal infections of the mouth, which can travel to the lower tract, which can include the respiratory tract as well as the swallowing tract. So, these people who are vulnerable to the oral cavity infections, they should take special care for preventing these infections. And now, prevention is the most important thing. And so we come to the maintaining of your oral health, how to do that and how to maintain your oral health. So first, that you should have regular checkups, dental checkups, to rule out any dental caries or any dental infections. You can get a cleanup for your mouth dental infections also. You should have brush twice daily and maintain a good oral hygiene. Fluids should be more, and oral intake of fluids, if it's not restricted by your cardiologist or a nephrologist, then your oral fluids should be high, and water, lots of water should be consumed, so that your tract is good and it is not dry, which is vulnerable to oral infections. And then you should dental floss daily. You should use a tongue cleaner, which should be tongue scraper, which should be atraumatic. It should not cause any trauma, but a light one or a soft one can be used to clear your tongue also from any plaque. Also, it's important that you should smoking, those who are tobacco users should try to avoid those tobaccos, and those who are taking something like supari or any form of quid, they should also avoid that, because that's a possibility of getting an infection, and also it is a probability to have cancer because of these things. And also consume a balanced diet which is full of antioxidants. So usually fresh vegetables and fresh fruits are full of antioxidants. So they should be consumed so that any injury or anything that happens in the oral cavity, any insult to the oral mucosa, can be taken care of by a lot of, because antioxidants, they improve your healing properties. And so healing is good because of the vitamin C and all the antioxidants which are present in fresh fruits and vegetables. So they should be consumed. And the bottom line is that since your oral flora, which is the normal flora, your friends in your oral cavity are there, they are important in body's defense. But at the same time, if the oral hygiene is not taken care of and all these factors are not taken care of, then you are at risk of having certain lung infections, certain conditions which can land you in problems. So it's very, very important that good oral hygiene practices should be followed, and good hydration should be followed, so that the bacteria which are which can lead to exacerbate respiratory infections can be prevented. So thank you.